Ontario's expert science advisors say COVID-19 hospitalizations and ICU admissions will likely rise as more public health measures are lifted, but nowhere near the levels seen at the peak of the Omicron wave. But they also say it's important for people to remember that the pandemic is far from over. New modeling released today by Ontario's Science Advisory Table ahead of mask mandates being lifted Monday in most settings suggests that if there is a moderate increase in COVID-19 transmission, hospitalizations will likely rise, though they won't exceed 1,000. But it depends on people's behavior.
If we pretend the pandemic is over and on March 21st switch, as I've seen it in my original home country, Switzerland, where all the restrictions were lifted and people basically pretended there's nothing happening anymore with the pandemic, then this could backfire.
Dr. Peter Uni feels a bit uneasy about the mask mandate being lifted in schools after March break. He says a few more weeks wouldn't hurt.
Schools are a bit of a challenge because students continue to stay in the same room with each other for 6-7 hours a day. And that's a higher risk setting there.
Right now, fewer than 50% of Ontarians have their booster shots, about 7.1 million people. The science table says those third doses helped cut hospitalizations and ICU occupancy by about 30% at the peak of Omicron.
Also, of course, the numbers of infections that have happened in the province, we estimate that we're probably around 3.5 to 4 million infections that have happened since 1st of December. And this, of course, contributes to the growing immunity in the province.
Dr. Uni says despite the mask mandate being lifted on Monday, they are still vital in the fight against COVID.
Make masks more part of our daily lives right now, still for the next few weeks, even though they're not mandated, and don't pretend all is over. It will help ourselves and it will also help others, especially those who are more vulnerable.
A spokeswoman for Health Minister Christine Elliott says Ontario's hospitals can continue to manage what is projected in today's modeling.